segundos.
Well, I hope that the 30 seconds have already elapsed. I suppose that there's Portuguese translation is already available. When I'm speaking in the Spanish channel, you're more than welcome. Good morning, good afternoon, good evening to everyone that is here with us today, not just here in the Americas, but we also have our experts that come from Europe. Welcome. Thank you for joining us today. We wish to welcome you. This is a seminar on the prevention of ASF. Today, we are going to have the continuation of our latest or most recent seminar, which took place in August, which has to do with plans for emergency response for ASF. So this is the second part. So we are going to give continuity to this very important issue so as to prevent ASF. My name is Erika Calderon. I work for IICA. This event has interpretation, simultaneous interpretation. The languages that are available are English, French, Portuguese, and Spanish. So please select the language of your choice. As described in the previous video, please tell us from which country you're joining us. So we kindly invite you to write where you are participating, what institution you belong to. This information is extremely important for us. I would like to remind you that the organization of these seminars is a joint effort between regional, national, and international organizations that work in favor of animal health, food safety, and other topics for the hemisphere that are important for the hemisphere. So this training initiative is coordinated by an interagency initiative, which gives responsibility to ICA to coordinate abilities for preventing ASF for Latin America and the Caribbean. Let me mention the agencies that are part of this working group. It is made up of CARIBET, CAPSA, OMSA, FAO, LECA, CAN, CBP, USDA, IRSA, COPEC, and ICA. We are going to have lots of presentations, experiences, presentations by the colleagues that will be giving presentations today. We are going to have participation by Dr. Peter Tack. He is the head of the AusVet Plan program on animal health in Australia. He will tell us about his entire experience with regard to the development of the AusVet Plan in connection with things having to do with preparation for response to ASF, operations manuals. We are going to have participation of Dr. Marius Masiulis from the State Service in Latvia, and he's going to share the experience of developing contingency plans. So we are going to share the vast experience we have with Dr. Marius, and we're also going to have Dr. Ana Ramirez Vela. She's the head of the unit of animal health and food auditing at the DJ Sante department in the European Commission. She's going to share her experience in the European Commission as well as implementation of contingency plans or emergency response for ASF. So as you can see, we are going to have a very rich panel of experiences that are going to give us this knowledge as well as experience that we've had in the case of countries that have coexisted with this virus already. So without further ado, I am going to kickstart the first presentation. Because Peter is in Australia and there is an hour zone difference with regard to Latin America, Peter has prepared a video for us. So if you have questions or comments to share, if you want to participate directly with them, please share your questions and we are going to share them with them. The goal is that we may have feedback by them. So I would just like to remind you that this is a webinar that is being broadcast through social media, through ICA's social media, on YouTube and on Facebook in Spanish. And all of these webinars are recorded. They are recorded as part of social media so that we may see them later, so that you may have a discussion on this later. If you do not have enough time for being on the webinar, please get prepared for this entire contingency having to do with ASF, so as to prevent this very serious disease. So I kindly invite you to disseminate these training efforts, which this group intends to reach with all of you. So we are going to get started with the presentation by Dr. Peter. Peter Dag. I'm going to read his bio. Dr. Peter Dag is a veterinarian. He has a long-lasting experience in the Australian government as well as in the private sector in animal health, biosecurity, biosafety, risk analysis in connection with imports, food safety, and public veterinary health. He has also participated in emergency response for over 15 years, and he has played key roles during the epidemic of the flu and as well as H1N1 flu. Dr. Peter is passionate about practical science-based solution for the policies of response to animal diseases with the goal of guaranteeing that time is not lost in the response to these outbreaks. So I'm going to give the floor to our colleague Miguel, who is going to share the video.
Por favor, les recuerdo que vayan haciendo sus preguntas a través del chat. Así, ya sea en redes sociales o sea acá.
So please share your questions on the chat, whether it be on social media.
Erika, hay un problema con el video ya que no me permite compartirlo por la resolución. Dame un momento para ver si podemos solucionar ese problema.
Ok. Si ves que se va a tardar más de 5 minutos, podemos
There are problems with the video resolution. So if you believe that this is going to take more than 5 minutes, let's move on, please, with the coming presentation so that we may share the video in a more manageable format. Perfect. So, Dr. Marius, I don't know whether you have a problem with us moving on with your presentation. Let us switch positions in the agenda.
No problem. I can start.
Perfecto. Entonces, el Dr. Marius nos va...
So, Dr. Marius is going to present the experience of Latvia and the development with Latvia. And before that, he's going to share some background. Let me share his bio. She's reading the bio right now. Marius
comenzó a trabajar en el Servicio Estatal de Alimentación y Veterinaria como subjefe del Departamento de Salud y Bienestar Animal. Después de 4 años se trasladó al Departamento de Respuesta a Emergencias y lo lideró hasta el día de hoy. Como jefe de la División de Respuesta a Emergencias, coordina el control de las enfermedades animales contagiosas es responsable de la redacción y renovación de los planes nacionales de contingencia y está profundamente involucrado en la redacción de la legislación relativa a las medidas de control de las enfermedades animales, incluidos los requisitos de bioseguridad para los criadores y cazadores de cerdos africanos.
He's continuing to read the bio of the Latvian colleague. He has been involved in eradicating ASF, classic swine fever between 2009 and 2011. So she's doing it. So with this, let me introduce Dr. Marius. Dr. Marius, you have the floor.
Thank you very much for the introduction. So good morning, good day, dear colleagues. It is a pleasure to be a part of this webinar and to have the opportunity to present our experience in developing and practical implementation of contingency plans for African swine fever. Just a few words about my country. As you can see from the map, so Lithuania is a very small country in the eastern part of the Europe. So we belong to the European Union. Our area is rather small. We have our area is only 65,000 square kilometers, and 1/3 is covered by the forest. Unfortunately, since 2014, we got African swine fever in our country, and the first introduction was and still remains in the wild boar population. Here you can see from the report how many countries are already suffering from this disease and how many countries trying to control and to eradicate African swine fever. Of course, we were the very first country in the European Union who firstly detected this disease, and still we have some cases in the wild boar and some outbreaks in the domestic pigs. So our control of African swine fever is strictly based on the European Union strategy. What we did, of course, we started to differentiate the farms into the non-commercial farms and commercial farms, firstly establishing the measures for the biosecurity, having the strict movement control, and of course active and passive monitoring, and official inspection and the entire chain. As African swine fever is mainly present in the wild boar population in my country, it is very important for us was to start to manage the hunt and of course to implement some of the surveillance activities, mainly active when the wild boars are hunted, to test them for the presence of the African swine fever virus and as well antibodies, to monitor the disease epidemiology and evolution, and focusing to the passive surveillance while looking to the carcasses by collecting and safe disposal of them. Very important role play in Europe wild boars, and of course for the management we pay a lot of attention. Biosecurity measures has been implemented and introduced firstly to the hunters, and they are as well officially inspected. Awareness campaign, so targeting to the pig keepers, private veterinarians, public in general, and hunters, and of course the others who might be the mechanical transmitters of this disease. What is again is considered as very important, so the compensation scheme and some of the incentives to the pig keepers, public or hunters, and of course the basis, that's the legislation, including contingency plan and emergency measures. So what is the contingency plan? We perfectly understand that is the plan to ensure that the country is prepared for an emergency. It should consist of the information on resources, on the legislative and administrative aspects. It should consist a description of policies, strategies, and procedures for effective disease control measures to one or more high-3 transmissible animal diseases. But what we have understood that African swine fever contingency plan should be a well-articulated strategy document designed to define actions to be taken in the event of an African swine fever emergency. Why it is so important to have a contingency plan? It should not be only a piece of the paper, because the contingency planning, it is an ongoing process. And the main objectives of having contingency plans should include to reduce the impact of the disease outbreaks on the health of the national animal herd. In our case, that's the domestic pig population, and to minimize disruption to trade and the society in the event of any disease, to increase the protection of human health. So the contingency planning should always remain a dynamic process. And of course, the focus should be given to the preparation and its flexibility. It should be integrated into ongoing operational planning activities, because it provides useful input to emergency managers, and it should be an integral part of preparedness activities. I think that's really clear. The examples on how to prepare the contingency plans, or as well, we can find some of the specific national disease contingency plans available on the former site of the OIE, the current World Organization of Animal Health. As well, we can look to the FAO Development Animal Production and Health Manual on the preparation of African swine fever contingency plans. But of course, all those suggestions, recommendations should be adapted to the local situation. Why it is so important to have a clear legislation? Because the countries might not be able to develop their own contingency plan if they are not forced. Luckily for us, we have the clear legislation in the European Union. So one of the examples, that's the regulation on transmissible animal diseases, amending and repealing certain acts in the area of animal health, so-called animal health law. And if we look deeper, what is stated in this regulation, it requires that each member state, each competent authority of the member state should draw up and update contingency plans, and of course, when necessary, to provide the detailed instruction manuals on implementing of the measures to be taken in case of a category A disease, to which African swine fever belongs as well. Another legal requirement is that the competent authority should establish an operational expert group as a part of the contingency plans. Of course, these plans are to be designed to ensure a high level of disease awareness and preparedness, and to provide a rapid response in a case of an outbreak of African swine fever. So what is stated more in the legislation? That, of course, the contingency plans shall cover at least the following matters: the establishment of a chain of command within the competent authority and with other public authorities to ensure a rapid and effective decision-making process. In other words, it should be the chain of command who will act, firstly, to take a decision, to make a decision, and to act. Then it should be the framework for cooperation between the competent authority and the other public authorities and relevant stakeholders involved to ensure that actions are taken in a coherent and coordinated manner. The contingency plan should grant the access to facilities, laboratories, equipment, personnel, as well emergency funds, all other appropriate materials and resources necessary for the rapid and efficient eradication. Of course, availability of the following centers and groups with the necessary expertise to assist the competent authority. In other words, it should be the expert groups which provide the scientific and expertise-based assistance to the competent veterinary authority. If it is possible to do the emergency vaccination, the provisions on emergency vaccinations should be in place, but that's not the case for African swine fever. Of course, the principles for the geographical demarcation of the restricted zones and coordination with neighboring countries. In the other words, we should have in the contingency plans the following chapters: legal powers, financial provisions, chain of the command, National Disease Control Center, Local Disease Control Center, laboratory, chain of laboratories, communication, including external communication, expert groups, availability for the adequate resources, specific instruction manuals, how to kill the animal, how to dispose the large group of animals, how to provide the disinfection. So everything should be included into the instruction manuals or the standard operational procedures. And to test if the contingency plan is really a strategic and working document, training, alert drills should be in place, as well as the chapter for the publicity and disease awareness. So this is a typical example of the chain of the command, how we are working in my country. So, of course, the State Food and Veterinary Service Chief Veterinary Officer acts as the competent veterinary authority, which have the close communication with the National Disease Control Center. Then there is the communication with National Crisis Center, which provides some availabilities to the other institutional resources in the close cooperation with the government. But on the top, as you can see, so that's the European Commission, to which we have regular communication, notifications, exchange of the information, and in most of the cases as well, the coordination of the different measures implemented in case of African swine fever. So what is the structure of the national contingency plan? In our case, we have a resource plan, a specific disease contingency plan, and different operational manuals, which help us to act in different situations when eradicating the different size of African swine fever outbreaks and the different type of the farms: backyard, small commercial farm, or even large commercial pig farms. So what are the main actions when African swine fever outbreak is confirmed? We immediately establish official ban to move the pigs, so the movement is forbidden. Traceability of dispatched pigs and farms in contacts are in place. The competent authority establish immediately protection and surveillance zones with the temporary movement ban of all the susceptible animals. And there is the activation of contingency plan. What does it mean? Establishment of the control point of entrance to outbreak farm, and the biosecurity measures should be in place. Epidemiological investigation starts when the outbreak is officially confirmed. Culling or killing of the sensitive animals, so all the animals on the affected farm should be culled, following the destruction of the carcasses and the cleaning and the disinfection. So that's a few examples how the interinstitutional cooperation is in place. That's the one of the example when we had a large outbreak in the commercial pig farm with 20,000 of pigs. Of course, so there was some involvement of the police to help the competent authority to isolate the main roads. And of course, the army helped us to control the established surveillance zone and to allow to control the movement. Another measures when African swine fever outbreak is confirmed, so that's the all susceptible animals kept in the affected establishment shall be killed as soon as possible on spot within the establishment in such a way as to avoid any risk of spreading the disease agent during or after killing. Then the all appropriate and necessary biosecurity measures shall be taken to avoid any possible spread of disease. Then the bodies or parts of the animals which have died or have been killed shall be disposed of, including all potentially contaminated products, materials, or substances present in the establishment. So they can be disposed or processed if possible, following the cleaning and disinfection measures. And of course, the disposal should be completed under the supervision of official veterinarian. In theory, that sounds very easy, but in practice, all those steps sometimes are very difficult, and it's very well if you have already them prescribed in the contingency plan. So, for example, for the culling, we have a question list which always help to make a choice, because while performing the proper culling procedures or killing procedures, you need to know how many animals are on the farm, what are their housing conditions. If you use different methodologies for the killing, what are the limitations and which methods are available and approved in the country. So how many people or how many equipment will be necessary to kill the affected farm, and what are the consequences for the rest of the contingency plan. So we should take into account the safety of the personnel, of course, animal welfare. We should calculate some of the costs, then the procedures on how to remove the carcasses following the biosecurity. In our case, that's the challenge, how to manage different type of the farms, how to kill the domestic pigs. There are the various methods available, starting from the lethal injection, captive bolt, electrical stunning equipment, and the carbon dioxide, which has been adopted to be used in our large outbreaks of the where they are commercialized and where the numbers of the pigs are kept. So electrical stunning, of course, again, we have the description of the methodology, how this electrical stunning equipment should be used, how many people or personnel are necessary to work with such a electrical stunning equipment, how many pigs they can kill, how quick those actions can be performed following the safety procedures. Of course, the work is dangerous, and all those aspects should be taken into account. But if you develop the plan, and if you revise it and update regularly, and we did it after each year by having the African swine fever in the different size of the pig farms, of course, we have improved our contingency plan by adding different elements as the precautionary measures, as the safety, as the biosecurity, how to work, and of course, we started to use the other methods which previously haven't been even taken into account. So they were included into the contingency plan as well. And one of such methods to kill the large amount of the pigs, so that was the usage of the carbon dioxide gas. In Lithuania, it is available in such as cylinders or in the large tank. So we have adopted some of the trucks. We do not have any special equipment. So what we did, we have used all available tools which are available on the farms. Trucks for the feed, or even the tractors which deliver the pigs to the other farms or to the slaughterhouse. You just easily build the ramp. You establish the possibility to chase the pigs inside. So the most important, that the soft roof would be available. So we have adapted to our current situation. So we have established the possibilities to use the cylinders and to connect them with the water hoses, properly counting and calculating the amount of the CO2 which is used for the killing purposes of the pigs. because in some of our legislation, it is clearly stated that the CO2 is suitable for the mass killing of the pigs if the concentration inside the medical container has been reached to 80%. So as you can see, we have easily developed the possibility to use it on spot. And then, of course, it's very suitable to kill the numerous of the pigs in a very quick time. And using such a method, we have killed the pigs being at the different age and the different size. Another challenge for most of the countries are the disposal, because of course we understand that we can kill much quicker as our disposal capacities allow us to dispose the carcasses. So the most common disposal methods for carcasses and other materials, so there are burial, either at an existing licensed landfill site or in a specially designated and excavated pit. So burning, either on a fire, so open air burning, or in an incinerator or pit burner. In most of the countries, burning is not allowed due to the environmental purpose. So that's mean you should always, when establishing the contingency plan, you should always think about the other possibilities of the carcass disposal. So you should not have the method which would limit your disposal capacities, but at least several methods should be taken into account. For the very well-developed countries, when they have the rendering establishments and the safe collection capabilities, so the rendering and incineration, best method which works very well. But in some of the countries, they're using composting or even disposal by alkaline hydrolysis. And that's always the challenge for the countries which suffer from the disease and where the disease affects the large commercial pig holdings. Because as I said, you can kill much quicker as the carcasses would be disposed. So then there are many questions: where to store the carcasses, what to do with them, to burn them, to bury, render, or incinerate. And then, of course, what are the cleaning and disinfection procedures which should be followed the entire process. So the best if everything would be already foreseen and included into contingency plan. Again, I would repeat myself, after each year when we got the new outbreaks, and especially when there were large amount of the pigs affected, we have revised and updated our contingency plan based on the lessons learned. So what actually we did, because we had several possibilities to use the small incineration with the very limited capacity, which could be suitable for the backyards, but not for the small or even middle-sized commercial pig farms. Burning on site, it has been done at the very beginning in 2014 and 15, at the beginning of the disease. But then we realized that due to environmental purposes, so burning is not an option for our country. And we started to use the burial and to bury the carcasses on site. Of course, when considering the disposal, several factors should be taken into account, and they should be considered as occupational health and safety. Is the method suitable to inactivate the pathogen? We should always take into account the concerns of the environment, availability of capacity, if there are adequate funding available, staff, social acceptance, and of course, acceptance from the farmer side. Are our disposal methods not suitable for the scavengers and vectors? And of course, we should think about the economic impact. So how we have amended our biosecurity measures and the contingency plans. We started to intervene the commercial farmers to establish, to approve, and to have pre-agreed places on the territory of the farms or nearby where in case of the animal disease outbreak, the kept animals would be buried. So we reached that all the commercial pig farms already have such a places approved and agreed. And the main attention was paid to the level of the groundwater. So if you have an outbreak and we see that's the enough place to perform the burial, so then the pit is excavated. So here's an example from one of our outbreak with 24,000 of pigs involved. So the decision was taken to bury all the killed pigs directly on the spot in the already agreed and approved place. I apologize for not the very ugly pictures, but that's how it looked like in the reality. And of course, we started to develop the pit and to use the different layers, feed and bedding material together with the carcasses in order to properly maintain the pit and actually to be able to dispose the large amount, so several thousands of pigs in one place. So how it looked like again, we have used the contaminated feed and bedding material to cover the carcasses. So those layers have been act as an absorbent layer. Again, we got this knowledge from the previous outbreaks when we haven't used some layering system, and we have seen how many troubles can be if you use only the carcasses, because you might expect the explosions, you might expect the leakage of the body fluids. So again, the contingency plan was revised, updated, and everything has been done in the proper way, using the different layers, maintaining again feeding, bedding material, and it gave us the chance to maintain the burial site very properly. And that's the final result. So at the end, we have used some of the methods proposed by the Outbreak plan, and we will see, I think, some in the next presentation, again, some experience and how those methods were developed. But we as well have been implemented their experience into our contingency plan. As regards the cleaning and disinfection, so those operations and the measures to destroy the rodents and insects are performed using officially authorized products, and they are carried under official supervision and in accordance with the instruction given by the official veterinarian. So those disinfectants and their concentrations must be officially approved by the competent veterinary authority, because they should ensure destruction of African swine fever virus, and the efficacy of disinfectants must be regularly checked before usage, because it might be diminished by prolonged storage. So again, how it looked like in the practice, all the steps are described, how many people should be involved, so the number of the personnel, the number of the equipment to be used, and then even the killed pigs on spot before they would be delivered to the rendering or disposal site need to be disinfected, as well the roads where the carcass are transposed to the burial sites. Even in the case of the backyard, all the procedures should be already included into contingency plans, as the personnel would be trained and experience on how to use these methods properly and safely. Of course, after the cleaning and disinfection, we perform the sealing of the stables in order to allow that the disinfectant would really perform the killing of the African swine fever virus and would work effectively. That's some of the examples of the cleaning of the large commercial pig farms. All the equipment needs to be removed, properly cleaned, disinfected, including the feeding and air conditioning, watering systems. So everything is removed, washed, cleaned and disinfected. And that's at the final stage, you, as a competent authority, can be ensured that the disease is really eradicated and the virus is eliminated. All the equipment used, including all the vehicles which has been on the infected farm, so they are cleaned and disinfected, and only after some appropriate time frame, they can be released out from the infected farms. Even some of the farmers, so they're using the disinfection outside the stables, which is okay and in line with their contingency plans, because each commercial pig farms have their own contingency plans, which had developed and prepared based on our competent authority contingency plan, which help us again to communicate and to cooperate with the farmers and between the governmental institutions. Trainings, that's the very important steps, because it should so that the staff should be trained on the general steps to be taken in emergencies. Of course, the staff should be trained on the diagnosis, including collection and transport of specimens, how to perform the epidemiological investigation, on the biosecurity actions, of course, killing, disinfection, and disposal procedures, but very important, traceability and documentation, and information exchange and public awareness procedures. The best if it would be established already the different training levels to the specialized training for expert teams, general trainings for supporting personnel, and the public awareness via media. And to conclude, African swine fever contingency plan shall define actions to be to be considered or be taken in the event of an emergency. When prepared, those plans should not be treated as a static document, and they should be regularly reviewed and updated. The staff involved in the outbreak eradication should be trained in their roles, duties, and responsibilities, and real-time alert exercises and audits are important tools in verification of the effectiveness of the African swine fever contingency plans. So thank you very much. Thank you for your attention. And as you see, we have always the light at the end of the tunnel, and this tool can be used as a contingency plan. Thanks a lot.
Muchísimas gracias, Dr. Masiulis. Realmente interesantísima.
Thank you very much, Dr. Masiulis. Very interesting, your presentation. I think that this is something that will really help us in all of our region, so that it can give us an example of all those elements that we have to take into account at the moment of preparedness. I think that it is really very useful to make use of all the experience of the countries that have already had to live with this, coexist with this pest, with this illness, and that really have faced this very successfully. Thank you very much for all your experience. And well, we are going to wait for the questions, because there are many questions already in the questions and answer and in the chat. So thank you very much. We're going to continue right now with the agenda. Dr. Anna, I don't know if there's any problem for you to be the next one. We are going to leave the video of Dr. Dak for the end. So if there is no problem, no, there is no problem. Thank you. Okay, so we're going to present your dissertation, which is going to be in regard to the experience of the European Union in the implementation of the contingency plans or emergency response facing swine fever, African swine fever. Some background in Dr. Ana Ramirez Vela. She is a very veterinarian with a master's in project management. She has experience as a cooperant in the projects of veterinary development plans for public and security since 2003 in the European Union, first as an inspector or auditor in different areas, like, for example, food safety, health, animal health, control and investigation, and later as the person in charge for the European policy for animal well-being and manager. Currently, she is the head of the unit for the General Directory of Food Safety in the directory responsible of audits and analysis in Ireland. Her unit covers the primary production areas, sanity, and animal well-being. So with that background, Dr. Ramirez, the microphone is all yours. You can now share your screen and your presentation. Thank you very much. I don't know if you can see my presentation now. Yes, you do see it. Okay, perfect. First of all, I would like to give you my appreciation for inviting me to participate. I'm going to present the point of view that we have from the European Union in the use of contingency plans or emergency plans regarding the African swine fever. A small introduction is that the European Commission has worked in the area of contingency since for a long time now, before having the African swine fever. Since year 1999, we have done more than 80 audits specifically in this area, in the area of contingency plans, so as to increase the capacity of our member states to be able to answer to emerging illnesses. We have also carried out seminars exclusively in the years 28, 17, 18, and 19, where we brought together the people responsible for the emergency plans of our member countries, and we were able to discuss procedures or other specific aspects of these plans and debate what was the best way of incorporating them into the plans or being able to face them in the case of emergencies. And we also have information that is destined especially to the specialized veterinarians of the member countries through the program that is called Better Training for Safer Food, BTSF for its acronym. These are periodic courses, and right now we are incorporating it right now so that you can also have access to this electronically, or they can have access to this electronically. As it has been mentioned by Dr. Masilius previously, the European law of animal health brings together the obligation of contingency plans in the 2003 and the simulation exercises in Article 2005. And it also forces the member states to incorporate the lessons learned, to do a constant review of the plans, and to incorporate into the plans any change that might take place in the resources of the administration, etc. As it has also been commented by Dr. Masilius, we have African swine fever since the year 2014. This means that luckily or unfortunately, we have the experience of countries that had it since the beginning, especially Lithuania, Polonia, Estonia, and Lithuania, which were the first ones that then acquired the illness. We have some countries that are still free of the illness in such a way that from the European Commission, we have been able to see, for example, how we are prepared or can incorporate the countries that are still free, the experiences of the countries that have had to use the emergency plans. We normally say that preventing is better than curing, but in this case, to be pure and direct, we consider that the emergency plan or the contingency plan begins at the moment in which we detect the illness or we officially launch suspicion in an official manner, in such a way that there is a part that doesn't go directly into the contingency plans, which would be what Dr. Mercedes has also commented, which is all the surveillance and the capacity of being able to detect in a very quick manner the illness. And this is something that really helps in the efficacy of the plans. In other words, the sooner we are able to detect the illness and we can start with the plan, we will have an easier time in containing the illness and in some of the cases eliminate. With African swine fever, it is costing us, as we will see, mainly because of the existence in wild hogs. If we compare with a fire detection system, for example, there are things, as I say, that do not go into the contingency plan, but that are very much linked to it, which is like, for example, the early detection, and that playing a very important role, both passive as well as the active surveillances, especially in the areas that we consider that are high risk. It also has a very important relevance that we have to do it in time before we have the illness, which is the design of the swine exploitation facilities, but especially the materials that are used, that they are easy to clean and disinfect, that they are isolated from the wild population and so forth. And then the plan, we have to take into account that it is a preparation that it has to give an answer to the possible and potential problems. As has been commented in the previous presentation, the contingency plan has many chapters involved. And the detail of each chapter or the detail of the manuals has to be different depending on the problem that we want to board. And we have to take into account that, for example, there are areas that are going to be boarded at the ministerial level. That can be, for example, where is the money going to come from in the case of an emergency to be able to pay and to compensate the producers. And we have some other areas that are also very much related to the field that are going to be applied locally. How are the animals going to be sacrificed? What are we going to do with them? For example, we have to ask if we are making an epidemiological survey and so forth. Regarding the contingency plans, what we have seen is that the countries use them as a first response to the outbreak of an illness. In other words, when we consider an emergency. In our case, since the illness has been present for many years now, we go more to a syncytial illness and one that is episodic. This is very logic because the services are already accustomed to dealing with this illness, and it is somewhat automatic. There are countries in which they still consider themselves not considered free, but it is more to control how we do the zoning, what are the rules that we have within Europe for the merchandising and to move certain food between different areas that have different status and so forth. Another one of the things that is very important is that the contingency plan is necessary for it to be a live document and that it has to have a constant update. The best examples that we have seen or that work better are the ones that when the services are capable of providing this update in an adequate manner and online. Why? Because when it has to go all the way down to the local level, the plans or the manuals, and there are things that constantly change, it is very difficult for all the staff to have the last version available. But nevertheless, if all the staff knows that there is a link where they can access or a website or something within their service where they can access, where they can see the last instructions or the last dispositions regarding any of the processes, it is easier for everybody to be in the same line of thinking. Apart from that, it has to be clear and practical. As I say, it is not the same to have to establish a process of how we're going to modify a national budget to include emergency measures, than to explain a private veterinarian that is going to participate in official tasks due to the emergency, what it is exactly that they have to do, who do they have to report to, what is the type of documentation that has to be filled out or collected. And this slide, I have recovered it from a presentation of 10 years ago that we did to the national veterinarian heads when we were talking about the contingency plans. And it is that the decision of investing or not, investing in prevention is something that is merely political. And it's a decision that is sometimes difficult when the risk is not appreciated as something that is close. 10 or 15 years ago, many of the countries were very reluctant to invest in the resources, in staff and in preparation and so forth, and in equipment, because the illnesses seemed very distant and there were other priorities that were closer. So it is important that to take into account that it's not the national head veterinarian who makes the decision, it's a decision that is made at a higher level politically, and that it is difficult to obtain political income for prevention because it is difficult to demonstrate how much money you're saving for having prevented something that has not happened. But nevertheless, it's easier to obtain political budgets from management of something that happened. Now it's easy that, for example, the countries for the European Union to invest into measures against the African swine fever because we have the illness present and because the countries that are free, they are seeing it coming. But nevertheless, this is valid for any emerging illness. Sometimes we have to make a decision. It's a decision that has to be made in a political level. This is somewhat complicated. Dr. Ramirez, please. They tell me that if you can speak a little slower, please. Of course. I'm sorry. Yes, of course. Within the job that we have done for the African swine fever, using the example that I have given, that we have countries that are affected and countries that still have not had the presence of the illness, we have done a series of audits looking at the preparation that the countries that were still free had and seeing if we could demonstrate to them what things they should improve in, having seen the examples of the countries that had been affected. One of the big areas where there has been a lot of problems is in the cooperation between the authorities. Why? Because for the management of wild hogs, this part is something that is related to the management of wild hogs. For the population of wild hogs, the veterinarian authorities normally, they are the ones that are in charge whenever there are animal illnesses present. But nevertheless, there are other authorities that are the ones that manage and regulate the hunting. And there are other authorities that are environmental authorities that are the ones that normally have the regulations in the protected areas, or in the natural parks, and so forth. Unless there is prior agreements or unless there is a good cooperation before the illness arrives, it is very easy to have differences. One of the biggest differences, for example, is to oversee for the management of the population. Should we eliminate wild hogs or not? How should they be eliminated? These things that seem to be easy or seem to be simple, but from a certain point of view, they are not simple for other authorities. For example, it's very complicated to make the hunters to hunt females and young animals because that's not their mentality. But nevertheless, with respect to the authority, veterinarian authorities, and say what they wanted was to reduce the population, that was a little bit what they wanted. So even though the hunting authorities agreed, many times they have found resistance that the hunters simply, that is something that goes against their principles. They will not hunt females or young animals. And also the environmental authorities that have a very strong pressure, social pressure, for example, in the natural parks, many times they have neglected the possibility of authorizing hunting in natural parks, and with which the population of wild hogs in those places have been completely out of control. And what we have seen in general in Europe is that veterinarian authorities have a great lack of knowledge of the populations of wild hogs. One of the cases, for example, most graphical ones is the case of Slovakia, that had a case in wild hog. They closed down a zone. They did an estimate of population. They calculated that there were probably some 250 animals that might be affected. And at the end of the time, between animals hunted and animals hunted, they exceeded 500. And this is the general thing for the majority of the countries, I would say. There is this overpopulation of wild hogs that, according to all the information, that although we don't have any very reliable data, it is growing. And nevertheless, the authorities, both those of hunt as well as the veterinarian authorities, underestimate the number of animals that are free. A very important point is early detection. This wild hogs is the population of wild hogs. This is one of the big problems that we are seeing in Europe. For this, what has worked better in some of the countries is that have the illness is the incentives, to hunters or poachers, as well as to the general public. Incentives that every time you discover a dead animal, you have to warn the authorities. And there are a whole lot of ways right now. There are authorities that even have an app in the mobile. You can indicate exactly the coordinates through the map where you have located the animal, and then the authorities will be able to go and pick it up. There are others that they call your local veterinarian office, and there are others that you can take the wild hog in and so forth. And there is an economic compensation normally that is very important so that the population might be even dedicated to searching for animals, dead animals.
Estas son algunas fotos cedidas por compañeros.
Here are some pictures that have been shared by some of my colleagues. We can see the overpopulations of wild boars that generate social issues as well, because they get as far as urban areas and they rummage through the garbage. For example, this is an image of Slovakia, which fenced in the area, and apart from electrical fences and physical fences, that they have used other fences. These are sponges that were, for example, humidified or dipped into the odor of wolves or bears, so that the wild boar would remain far from this area, and so that they might be able to kill as many animals as possible within the affected area. These are some types of cages used in various countries. This is Spain, for example. This is a natural park in Spain. This is in Poland. This is for the hunt of animals, and so as to be able to reduce the populations. This is one of the important aspects having to do with emergency plan management. Once again, it's all about management and biosafety, especially in the hunting grounds. For example, in the example at the top of the slide, we can see an incinerator that was implemented in one of the countries for the slaughtered animals. And this, as you can see, biosafety is more precarious here because the animal fluids can be seen all around. With regard to domestic pigs, one of the biggest problems that we've seen in the launch of emergency plans are quite basic. One of the first ones has to do with the ability or the capacity for sanitary emptying for pig farms. We know that, well, pig farms are becoming larger and larger. There's usually not a problem if a farm needs to be emptied if it doesn't have too many animals. But once you have over 20,000 animals in a farm, then the problem becomes a lot more serious, okay? So for this reason, the contingency plan needs to provide for the equipment that will be used for culling the animals. In our case, there are European laws that need to respect the animal well-being as well, so it's not that you can use any method. And who is going to perform the culling? Will it be the local vets? Will they bring someone from the slaughterhouse? Will clinical vets be used to lend a hand, for example, etc., etc. And all of this needs to be done through a series of calculations, and it needs to be done, if possible, considering the worst possible scenario. That is, we have to focus in what would happen if we had an outbreak in an area with high animal density, because in a low density, in a low animal density place, it's not so easy if you need to kill like 40 heads of cattle, for example, or if there is, for example, survival farming. It's not so complicated, but we need to make calculations of how many animals we can kill per hour or per day, and how are we going to kill them, what equipment will be used, as well as the human resources. For example, do we need gas, for example, in what amounts? Same thing for HR. Who is going to take care of manual tasks? Contracts need to be in place. Are we going to use companies? Are we going to use... Doctor, you've missed your sound. This is tightly connected. Okay, yeah. The original audio went away for a sec. So this is tightly connected with the ability to destroy and do away, dispose of animals and other materials. As was explained in the prior presentation, what are we going to do with the carcasses? Will they be transported into incineration plants? What trucks are going to be used? All of that needs to be planned for. Usually burying is a little bit problematic, especially in the EU, because there are environmental authorities. So you need to have prior agreements with the authorities. delays that can generate delays. Same thing applies if we have a highly rural country, for example. It can be a little bit easier in that case, but what happens with highly urbanized countries? How do you go about burying the carcasses? Usually incineration in byproduct plants, which is a very common system. It's kind of the same situation. We need to know our capacity per day, per hour. Will this mean that the slaughterhouses will not be able to process their waste? Will we get priority for that? Do we have prior agreements with the companies? Are the companies state-owned or private? How will they be prioritized? One of the extremely big problems that we are seeing have to do with human resources. It's not because there are not people available, but actually because they are past due. What do I mean by this? Veterinarian authorities usually have animal health departments, well-being departments, control departments, food control, and it's difficult to move staff around in the case of emergencies. For example, we've seen some very good examples. For example, in Germany, they have a very clear contingency plan. In case of an emergency, they know where to get the HR from. There are some other countries that have clarified this with private contracts, with private sector vets. Of course, the vets need to be properly trained on this, but they need to join official services quickly, expeditiously, so as to perform the necessary tasks. This is quite important because when there is initial entry of the disease, a lot of activities need to be carried out simultaneously. You need to concentrate on the site where the disease has been detected, and the animals need to be weighted. The animal movements need to be stopped and banned. Epidemiologic response is required. It's necessary to fence out the area for 3 kilometers, and it's necessary to perform a farm census right there. There needs to be bigger surveillance. Some animals need to be culled, their carcasses destroyed. So all of this happens in a relatively short period of time. So we require quite a bit of staff, and we need to know where that staff is going to come from. Another thing that is happening on a regular basis with contingency plans has to do with epidemiologic research, so as to determine how the disease has made its way into the area, etc., and when. But it's not just that, but also what will be done with the information that is gathered during this research. So we need to know who is going to go there, who will show up at the farm, so as to ask the questions. There is a report, a standard report that is included in the contingency plan in connection with the information that needs to be gathered. How will the information be conveyed? And who is going to use that information for decision making? This information needs to be sent to the local center, which may share it with the national center, so as to have an overview of what is going on. Another significant portion has to do with contingency plans for laboratories. In the same way as what happens with HR, all of a sudden labs may be overwhelmed by the number of samples in the case of an outbreak. So they need to have a plan for themselves so as to know where the reagents are going to come from, where are they going to get extra staff, if they need to process a big number of samples in a short period of time. If their schedule is going to change, will they be working on holidays, weekends? Where will they get the HR? Where will they get the money to pay that staff? And it is quite a common occurrence to use auxiliary labs, local or regional labs in this case. So importantly, these labs need to be prepared so that they have not just the reagents and the staff so as to perform necessary tests, but also in order for the tests to be properly accredited and to guarantee that the quality of the results is acceptable and that the results also come back timely, on a timely basis. The main challenges and problems that we are being faced with, I think that my previous colleague has clearly expressed this. First of all, non-commercial farms. These farms are manageable quite easily on a disease level because they own very few heads of cattle. Maybe they own like 20 animals and that's that, but it's very difficult to control them in terms of biosafety and traceability. Where do these animals come from? Where are they going? So these farms have a life of their own. For example, I'm showing one in the image. You can see this. For example, they have like 3 horses, 2 cows. Well, in this case, biosafety measures are very scanty. It's like one house that is neighboring with 3 houses or barns or sheds. So another challenge that we are being faced with is passive surveillance. For example, in the case of the white boar, suspicious cases are not identified. Well, it depends on what you consider to be a suspicious case. There are cases where there are big pig farms, and there are countries that are performing surveillance both in connection with the number of pigs that have been killed and, for example, production parameters are not controlled in some cases. For example, if the pigs stop producing or if they stop eating, there are delays when it comes to notification, and this creates problems. And another challenge is laboratories, not only the reliability of tests when auxiliary labs are used, as well as the timeliness of response. Because up until the laboratories get started on this initiative, there can be significant delays because of the number of samples that may get accumulated. Just a number of pictures to show you. Well, for example, these are pig farms in one of our member states. When the construction materials are difficult to disinfect and to clean, well, that can be a problem with an outbreak because we will find it hard to repopulate the farm afterwards. As you can see, there are other farms that are unfinished or the fences are down and there is no proper protection against wild animals, for example. And another key issue has to do with simulation drills. Drills are important. It's important to simulate stuff. We need to do this during peacetime, as we say, when the outbreak is not yet there. So when there is an outbreak, this is the best exercise that we can engage in so as to learn and to incorporate the lessons learned. One of the problems that we are seeing with simulation drills is that oftentimes they are carried out on a local or provincial basis, and the lessons learned are incorporated only in the local or provincial manuals. So opportunities are missed to share information on a national basis and to get other provinces or other regions to incorporate the lessons learned. Usually simulation drills, as we said before, it's necessary to invest our efforts in prevention. This is a difficult decision to make when the risk seems to be far away because services always find other priorities that need to be catered to first, and that is how things get postponed. And well, so what happens in that case? Contingency clays, oftentimes when they are launched, they work only relatively well, and there is quite a bit of improvisation going on as well. So that's it. We believe that it's very important to plan well, because if you fail to plan, you're planning to fail. And you will fail when the outbreak happens. That's it. Thank you. Thank you, Dr. Anna. Your presentation has been extremely interesting, and this also provides us with an overview of the shared problems that we have. This is something that we are facing in the region as well when it comes to staffing. The HR that needs to get mobilized, and in order for us to have the number of official services, everything having to do with lab capacity or diagnostic capabilities, all of that is a challenge for our region. To that, we should add the non-commercial, the backyard farms. This is quite a challenge in our region. Because it's also difficult to identify them, to map them out, having these backyard farms identified. So thank you so much. This overlook that you have just shared with us has been extremely interesting. You have spoken quite well of how contingency plans have been dealt with in the various countries. There's also the drills that we have. Drills are something that we have prioritized as well in our region, so as to put these contingency plans to the test. So this is very rich. This is rich information which confirms that we are being steered in the right direction. Thank you so much, Dr. Ramirez. Several questions have been posed. So towards the end, we're going to entertain those questions. And thank you so much for sharing this panorama, this experience that you've had for so many years in your fight against this problem. Before moving on with the next presentation, I would like to tell you that we've had the participation in this webinar of the Peruvian Association of Pig Keepers in Peru. We also have SENASA, Peru, SENASICA, Mexico, the Group for the Prevention of ASF, in Argentina, SENASA from Argentina, IPSA, Nicaragua, the Colombian Agricultural Institute, the Pronaca Aspe from Ecuador, the Association of Livestock Breeders in Ecuador, the Veterinarian Services Department in Barbados, in Vima, Colombia, the Ministry of Health and Wellbeing of Jamaica, the Ministry of Health, Environment and Nature of Curaçao, Cirat Caribet from Guadeloupe, the Office of the Regulatory Office of St. Lucia, the Food Health Department of Guatemala, ICA Colombia, connection reports from Venezuela. So as you can see, it's highly encouraging for us to know that we have integration throughout this participation and throughout this preparation. We have the private sector as well as the official sector. They are attending all of our webinars. So that's the goal. The goal is for all of us to get trained, because the only way in which we can deal with this scourge is by working together. So without further ado, let us move on with the next presentation, which will be delivered by Dr. Peter Dagg. As I said before, Peter shared a video with us because of the time zone difference. So I'm going to ask our colleague Adriana to share this video with us. Adriana, please go ahead.
Hello, I'm Peter Dagg. I'm the head of program for the Australian Veterinary Emergency Plan, also known as AusVet Plan, here at Animal Health Australia, based in Canberra, Australia. And this afternoon, I'd like to talk to you a little bit about emergency animal disease preparedness in Australia, how we go about it, what AusVet Plan is, and a little bit about our national animal health structure within Australia, and also provide some recommendations to countries that are actually looking to set up their own emergency animal disease preparedness and response activities. So today I'll cover what the Emergency Animal Disease Response Agreement, also known as EADRA, is, and also the Australian Veterinary Emergency Plan, AusVet Plan. I'll cover those in some depth. Then I'll also talk just a little bit about emergency response arrangements in Australia, how they all fit together, what happens in an emergency animal disease response. And then I'll focus a little bit on African swine fever in particular and our preparations for that, and what our AusVet Plan manual looks like for that. And then also just provide some recommendations for countries that are actually looking to develop their own strategies and response mechanisms, particularly for African swine fever. So to start with, I guess it's important to know that Australia has a very unique system in that we bring governments and industries together very strongly to work on emergency animal diseases. And when I talk about emergency animal diseases, essentially I'm talking about exotic diseases, so diseases that are not within Australia. So Australia is lucky in that we don't have many of the major animal diseases that are around the world. We're very lucky. We've been able to keep them out over the years. We are an island, so we've got a long way to get to here, which is probably to our benefit, kept the diseases out. But also we have very strict, international quarantine and biosecurity measures that aim to keep diseases out. But we are very, very prepared in case we do, the worst happens and we do end up with an emergency animal disease within Australia. So Animal Health Australia is a not-for-profit independent company that brings together governments and industries very strongly to respond or to prepare for emergency animal diseases. When I talk about bringing them together, they are actually members of us. So the governments of Australia are members of Animal Health Australia, as well as our industry peak bodies within Australia are our members. We, as Animal Health Australia, we manage a number of different animal health programs, and in particular, and the ones I'll cover today, are the Emergency Animal Disease Response Agreement and the Australian Veterinary Emergency Plan, or AUSVET plan. We also do a lot of other work in terms of delivering training and exercises so that everyone that needs to be involved in emergency animal disease response, if that were to happen in Australia, we've got as many people trained, so they're ready to go, they know what their jobs are, they know how to go about what they need to do, so that we can respond as quickly and effectively as possible. We also manage a couple of vaccine banks, so we actually have some vaccines available just in case we get emergency animal diseases, and so that they are ready to go in the worst case that we end up with an outbreak. So just talking briefly about the EADRA, which is the Emergency Animal Disease Response Agreement, and also the Australian Veterinary Emergency Plan, AUSVET plan. They're two specific programs of Animal Health Australia, but they are interlinked. And I'll just show you how this works. So the Emergency Animal Disease Response Agreement is a legally binding contract arrangement between Australia's governments and industry groups. So Australia's governments include the federal level government or the Commonwealth government within Australia, and then each of our state and territory governments. So they are signed up to this EADRA, and as I say, it is a legally binding document. And also industry groups are signed up to the EADRA. So when I mean industry groups, and I'll show you a slide on this in a moment, but industry groups are our national peak groups for industry organisations, and so they, as a collective, are signed up to the EADRA itself. The whole purpose of the EADRA is to reduce the risk of disease incursions occurring in Australia in the first place by making sure that we, as I mentioned before, Australia has very strong biosecurity measures at the border, but also just ensuring that industries and governments, within Australia are also very clear on what they need to do to minimise the chance of diseases either getting into Australia, or if the worst were to happen, they did get into Australia, minimising the chance of them spreading. The EADRA itself, so it's 20 years old now. It was signed in 2002, but before that, there was a lot of work going on for many, many years to bring governments and industries together to try and, identify the key elements of how we would go about responding to emergency animal diseases in Australia. The EADRA does only cover emergency animal diseases. There are other similar response agreements for plants, for example, and that's handled by a completely different company. It has 24 signatories, so as I mentioned, states and territories and the federal government, plus also a number of industry peak bodies as well. It's reviewed every 5 years formally, and that is currently undergoing now. It's undergoing its review now, but it is also constantly under review. We're constantly meeting regularly with our members. We have formal meetings every year, but we are just always making sure that it is contemporary and it meets the needs of all our members, and all the signatories to the EADRA, to make sure that they are all, the information that's in there is correct and up to date. It doesn't cover any technical details, but what it does cover is things like roles and responsibilities, so that both government personnel and industries know exactly what they need to do if there is an outbreak of an emergency animal disease. They know who's going to be doing what, when it needs to be done, and the decisions that will be made are actually shared between governments and industries. So we have, we make sure that industries are involved in the decision making so that, commercial issues can be considered throughout the whole decision making process, bearing in mind, obviously, that the whole premise of a response in Australia to an emergency animal disease, which we'll come to in a moment, is about eradicating the disease as quickly as possible so that we, as in Australia, can get back to, trading as business as usual. And here's a slide that just actually shows you the parties or the signatories to this IADRA. So these are the companies and the organisations who have actually signed the IADRA. And as I mentioned before, it's a legally binding document. So these parties that have signed to the IADRA, agree to the certain things that are outlined in the IADRA itself. So we have the Commonwealth and state and territory governments. Animal Health Australia is also a signatory to it as well. And then we have a number of these industries here, and you'll see, represented by their peak industry bodies. So, for example, we have, Sheep Producers Australia is the peak industry body at the national level that looks after the interests of sheep meat producers within Australia. And then sitting under the IADRA, supporting the IADRA, is the Australian Veterinary Emergency Plan, or AusVet Plan. And this is where the technical information is. And this is, AusVet Plan covers the preferred approach or the guidance that will actually occur if an outbreak occurs in Australia. And there's a number of different documents. I'll go into these into a little bit of detail just so that you understand how this all works. But basically, AusVet Plan is about the agreed national policy and guidelines that both agencies and organisations involved in a response to an outbreak will take, so that everyone understands exactly what their roles and responsibilities are. They know exactly what the policy will be if there is an outbreak, exactly how we're going to respond to it, and it provides all the guidance on how to respond to it, whether vaccine will be used, for example, whether animals will need to be slaughtered as in terms of response, and then it provides all that guidance so that everyone is very clear on it. They are public documents and they are on our website, as in Animal Health Australia's website, and that QR code there, if you link to that, you'll be able to go directly to the AusVet Plan webpage. So, I encourage you to actually have a look at the documents that are there, have a read of them so that you actually understand how we, as in Australia, how we go about responding to emergency animal diseases. And on the right-hand side of this slide, that covers the number of different types of manuals or documents that we have under the AusVet Plan, on the AusVet Plan website. There is an overview document, which is actually very worthwhile having a look at that, just so that you understand how AusVet Plan works and how it all interlinks. Then there are response strategies or disease-specific documents. So they actually provide the policy and the response strategy for an outbreak of a specific disease. And so for every disease that is listed within the IADRA that I mentioned before, there is an actual response strategy or disease specific document that will outline how we will respond to diseases such as that. There are a number of other different types of documents, which I'll go into a little bit of detail in a moment, but there's operational manuals, enterprise manuals, management manuals, and then there's a various guidance and resource documents as well. The first type, so I just mentioned, the response strategies or these disease-specific documents, they contain the nationally agreed approach to a response to an emergency animal disease in Australia. So the specific diseases that are listed within the IADRA, there is a response strategy for each and every one of those. And the idea of these response strategies is to ensure that we have a fast, effective and efficient response in the worst case scenario that there's an outbreak of one of these diseases, just so that things happen quickly. There's no time lost in debating how things will happen. It's very clearly already been determined through discussions through governments and industries, which Animal Health Australia facilitates, to make sure that everyone understands exactly what will happen during an outbreak itself. Then there are a number of operational manuals, and these provide guidance on specific.
Luego tenemos los manuales de cooperación y las guías específicas.
So, for example, if animals need to be destroyed as part of the response, then
Que
there's
para ver cómo deben ser destruir los animales y dispuestos en caso de contaminación.
Destroying animals.
Pero como bien, la destrucción de animales.
Contaminating premises and property as well.
Y descontaminar así tanto equipos como propiedades. Los manuales de administración que dan la manera de información y de estructura y el flujo de información que debe darse en el trabajo de emergencia del gobierno. Para el trabajo estructurado dentro de Australia. Perdón.
So and these provide two areas of information. One is information to governments about how the specific livestock industry works and how their enterprises actually work, so that governments gain a really good understanding of the industry itself. But also it provides very significant information to the industry themselves on exactly what will happen during an emergency animal disease outbreak and how the response will unfold, because it's really important that everyone knows exactly what will need to happen during a response situation, so that everyone can play their part and make sure that we respond as quickly and efficiently as possible. So what happens during an emergency animal disease within Australia? And this slide is quite difficult to see here, but what I'll do is I'll break this down a little bit for you. I'll just go through it part by part. Firstly, I guess it's the reporting of an emergency animal disease. So unusual signs detected in a disease in an animal are usually by the producer, usually by a farmer. They see something a bit unusual. It's not something that they haven't seen before. So they'll report it to a veterinarian within Australia. They may even call. We have an E8 emergency animal disease watch hotline, which everyone can contact, and if they contact that, it will go straight through to a government veterinarian, and they will, the veterinarian or the government veterinarian will investigate and have a look at what's going on. If there's a suspicion of an emergency animal disease, then a government veterinarian will definitely get involved and start taking samples. They'll actually advise their chief veterinary officer within their state or territory that they are, just to let them know that there is some sort of suspicion going on. And then there'll be an investigation just to see what is actually happening in the situation. In these early days, then samples, are obviously sent to laboratories. And within Australia, the CSIRO, Australian Centre for Disease Preparedness, is our reference laboratory for confirming or ruling out emergency animal diseases. And if we have a positive, if something comes up positive, the Australian Centre for Disease Preparedness actually identifies that we have an emergency animal disease, then the Australian Chief Veterinary Officer will be notified, and they will convene the Consultative Committee on Emergency Animal Diseases, which is a technical level group, and it involves the Chief Veterinary Officers from all the state and territories, also the Australian Chief Veterinary Officer, and also industry is involved at that point in time too. So the affected industries, so for example, if we're talking about African swine fever, then the pork industry will need to be involved at that level, and they will send a representative from their peak council, which is the Australian Pork Limited. So they will be involved in the discussions at that committee. Now that committee is technical, as I mentioned, and so they will be looking at issues such as, okay, is there a positive, confirmation from the Australian Centre for Disease Preparedness? Is it an emergency animal disease or not? Does the initial response strategy that the state in particular, that has the disease is as long as it's in line with AusVet plan, is it looking sensible? And then they'll provide information up to a higher level group, which I'll just move to in the next slide. It's called the National Management Group. So they'll provide information up to the National Management Group, and it's at that National Management Group level that decisions are made as to whether we will respond or not, what the response will look like, etc. And then, things will happen from there. So there's a formal process that we go through. It doesn't, it's not ad hoc. We have very formal processes in place, very formal structures, and very senior level people are involved to make sure that we are doing the right thing if there is an outbreak and how we respond to it. AusVet plan provides the basis for the actual response itself once that sort of situation is identified. So I just want to talk a little bit about African swine fever itself and the response strategy for it. So we have a very up-to-date response strategy for ASF. It was published earlier this year, earlier 2022. It's called version 5.1. So we've been doing some review of it over the years that it's been available. And obviously the latest version is very, very up to date and has the latest information in there. Again, I encourage you all to have a look at it, actually read the information that's in there, because it's very well structured, and I'll go through the structure of it in a moment. But it provides very useful information about the disease itself, and then obviously how Australia would respond if we were to get an outbreak of African swine fever. We've never had an outbreak of African swine fever in Australia. We've been very lucky. And, as I said before, we're doing everything that we can to keep it out of Australia. But if, the worst happens and it does get into Australia, then we have a strategy ready to go. Everyone knows what their job is. And, we can get on with responding as quickly and efficiently as possible. So this is the structure of the response strategy. And again, as I say, have a look at it on the website. It starts off with an introduction section, which just sets out the purpose and scope, and it has some training resource information in there as well. But it basically sets out, exactly what we would respond to if there was an outbreak of African swine fever in Australia, and exactly what that means. Then there's a lot of really useful technical information about the nature of the disease, about the nature of African swine fever itself. It goes into detail on the etiology and epidemiology, and also the diagnostic testing that will be required to ensure that we identify, if there is an incident of ASF in Australia. So there's a lot of really useful and really up-to-date information there. It's based on scientific literature searches and the latest information from our experts within Australia. Then there's a section on the implications for Australia. And obviously we know that, if there was an outbreak of ASF in Australia, it would impact on the pork industry very heavily. And we're aware of that. But there has been some, really useful information looking into, what the impacts would be. There's also some useful information about what the potential pathways for introduction of the disease into Australia could be. So again, we've identified these potential pathways. We've got the biosecurity measures in place to minimise the chance of it getting into Australia. But it's really useful to have a look at some of this information. Then I guess the latter half of the response strategy, the document itself, sets out the policy and rationale and exactly how we would go about responding to an outbreak of ASF. And then it covers things such as declared areas and movement controls, which I'll go into in a moment. But obviously, if there was an outbreak of a disease such as ASF in Australia, one of the key strategies to responding to it will be movement controls, actually stopping pigs moving, because obviously they carry the virus itself. So we will need to stop pigs moving in the hotspots, the hotspots where the disease will be, and making sure that they're not moving around and moving the virus around itself. And then there's some really, clear and useful information about how we would go about surveillance and ensuring that once we've eradicated the disease from Australia, how we can provide proof of freedom to our trading partners and also through to the World Organization for Animal Health. So what is the response, strategy, the policy? What would we do in Australia? Well, really, as I mentioned before, it is all about eradicating the disease as quickly as possible. That is our primary focus if we get an outbreak of most of the emergency animal diseases, if they got into Australia, our response would be to eradicate as quickly as possible. We also need to minimise social and economic impacts. So by eradicating the disease, we want to make sure that we don't do significant damage to the economy or to the industry itself. So that's why these response strategies are so important, to make sure that we have the right strategy to make sure we respond as quickly as possible but minimise the consequential damage that can occur to the industry. And then this will be managed through a matter of quarantine and stamping out of infected premises. So what I mean by that is, as I mentioned before, quarantine, so stopping the movement of pigs off infected premises, and also stamping out. And when I talk about stamping out, I mean destruction of pigs on infected premises. So that will reduce the level of virus, obviously within that area, safe disposal of those pigs to ensure that the virus doesn't get into the environment, and then, ensuring that movement of pigs within these hotspots doesn't occur so that they're not spreading the disease around. And then we actually call them declared areas within Australia, so things like restricted areas and control areas, so that we identify exactly where movements of pigs should and shouldn't occur. And then we obviously have some very strict and very in-depth surveillance and control of feral pigs, because feral pigs can get infected with ASF, obviously, and can be a source of infection for the disease. So we are very targeted on making sure that we do particular surveillance and control of feral pigs where there's any chance that they could be infected. And then there's a lot of work that we do in terms of public awareness, making sure that the public would be aware of the disease itself, and making sure where they can and can't go, and making sure that the public understands that pigs will need to be slaughtered for response purposes, which is obviously unpalatable, but it needs to happen and would be done in obviously a very humane and welfare manner. So if we actually look at a little bit of detail in the actual ASF response strategy itself, which, as I mentioned, you can have a look at on our website. And under the EADRA, the Emergency Animal Disease Response Agreement, which I mentioned before, we actually allow cost sharing of response costs. So when governments and industries need to respond to emergency animal diseases, the response costs are actually shared between governments and industries. Now, I won't go into any great detail on that, but I just thought I would explain that arrangement exists within Australia, because this is about ensuring that people that suspect disease report very quickly, so that they know they will receive compensation for their animals that need to be, if animals do need to be destroyed for the purposes of controlling emergency animal diseases, then they know that they will actually be assured of receiving compensation, so that there's an incentive there for people to make sure that they do report and not hide anything. And so this is taken out of the response strategy itself, and a summary of the response policy itself. So as I mentioned, it's about eradicating the disease as quickly as possible, minimising social and financial disruption, but using a stamping out policy, so destroying pigs on infected premises as quickly as possible, disposing of them as safely as possible so that they don't contaminate the environment. There's epidemiological assessments will need to occur, rapid recognition and laboratory confirmation of cases, implementation of these legislated declared areas, as I mentioned before, about restricted areas and control areas, application of biosecurity measures to prevent, and movement controls to prevent the movement of animals and also products from moving around and spreading the disease, and surveillance and tracing to determine the source and the extent of the infection itself. And then further to that, as I mentioned before, the compensation will actually be paid to people who report early. If they suspect any disease, then they'll be compensated for that if it turns out to be an emergency animal disease, and then followed by destruction and disposal of the pigs properly so that they don't contaminate the environment. Sanitary disposal, decontamination of premises as well to get rid of the virus over time, and then decontamination and disposal of fomites, things that could carry the disease as well. And also, really proactive management of animal welfare issues to make sure that we don't cause any unnecessary, welfare issues or concerns for the animals at all. And then recall of animal product, which may need to happen at some stage. And then, ongoing surveillance and control of feral animal populations, surveillance of tick vector populations if they're implicated in the epidemiology of the disease, relief and recovery programs. So again, we have strategies and structures in place to ensure that we support people, farmers, everyone involved so that they can get back on their feet as quickly as possible. Public awareness campaign, as I mentioned before, and also, support to the industry. So constantly looking at how we can assist the industry through the response itself. So I just thought I'd put this in just so that you see what a case definition looks like. So as I said before, the scope of AusVet plan is restricted to the detection of ASF in Australia based on this case definition. So for the purposes of this manual, a case of ASF is defined as laboratory confirmed infection with ASF virus in a pig. So that's the very clear and concise case definition. Then there's some notes there, serology in the absence of genome or antigen does not constitute a case, but warrants further investigation, etc. And so we have very clear case definitions within the AusVet plan to make sure that we are dealing with the correct situation. A little bit on movement controls. So, these are the basic principles, and I think everyone would understand these, but basically it's about containment and eradication of ASF is the highest priority. Therefore, it's really important to note that, normal business movements are generally not going to be allowed, particularly in those hotspots, So the industry knows this, and is aware of this. And again, through the public awareness campaigns, we make sure that this is very, very well relayed to the public. Live animals obviously pose the greatest risk of disease spreads, so therefore their movements are going to be restricted very heavily. We don't have a national livestock standstill for ASF. We only have that for foot and mouth disease, but there will still be standstills and there'll be movement restrictions, at least for pigs in certain areas. And then sort of outside of these restricted and controlled areas, we're trying to keep that outside area as clean as possible so that, there can be movements of animals and products in that outside area to continue at least domestic trade. That's what we're trying to aim for as much as possible. As I mentioned, we've got these various areas. We've got restricted areas and control areas, and we also for ASF have a concept of an infected area. And this is more to do with feral pigs. We're very concerned that if ASF got into Australia, we would need to be very much on top of the situation of feral pigs. So we have a strategy for looking at disease if it got into feral pigs. And this diagram here is just sort of a very basic diagram. It's not exact, but it's just to give you some detail or some idea of how movements would occur. So obviously you can see that within the restricted area, that's going to be where the infected premises are, and movements out of that area are going to be prohibited. And we really don't want animals going back into there either, because that's just increasing the number of susceptible animals in there, or pigs at least. We don't want pigs moving in there. And then, even from the control area, they may be allowed to move in, and these are pigs again, may be allowed to move into the outside area, but there would need to be a permit there, for that movement as well. And as I mentioned before, premises, so we've got infected premises, so they're obviously the ones that have got the case definition, has been identified on those premises. Then we've got a number of different types. We've got suspect premises, trace premises, dangerous contact premises, and also dangerous contact processing facilities. I won't go into these in any great detail today, but I just thought at least you could understand the types of premises that we have available, that would occur during an outbreak. And you can look these up in the manual itself, and it has specific detail on what each of these means. And then, movements are also going to be carefully controlled for other products and items such as, semen and embryos, meat and milk, dead stock, effluent byproducts, livestock vehicles, people and non-susceptible animals, crops, grains, etc. from infected premises. Just, all these things just to make sure that the disease is not spread around inadvertently. So we have these strict controls in place. This is a very busy slide, but I just thought you would like to have a look at exactly the detail of how we go about this. So these are the recommended movement controls for pig semen within and between declared areas, and you'll see that movements from, on the left-hand side there, the infected premises, the dangerous contact premises, etc., those high-risk premises, you'll notice that the movements of semen off those premises is prohibited right across the board. So we're not going to be moving pig semen off those high-risk premises for any reason. But then the others, they will need permits to make those movements happen. And then the detail, again, is in the response strategy itself. So I encourage you to have a look at that and actually look into the detail, have a look at what our, we've done a risk assessment too, which is the basis behind this matrix, so that we understand exactly how we want things to move or not move, as the case may be. So my recommendation is just going forward, I think it's really important that there is very good and strong communication between governments and industries, so that both governments and industries understand what's going to be needed, because obviously governments are focused on eradicating the disease as quickly as possible, but we're all on the same page in that we want to eradicate the disease and minimise the impact to the industry, with the view to getting back into trade, getting back into normality as quickly as possible. So governments and industries are on the same page, but it's really useful to bring them together and make sure that they're communicating. Establish the principles for control and eradication. Work out for your country what will be your control mechanisms and what will be your ultimate strategy. Will it be eradication, or will it be control and containment with the view to transitioning to some sort of management? But you just need to determine what those principles will be. Happy for you to use OSVET Plan, the format, as a template, because as I say, they're publicly available. There's a lot of information there. If you wanted to use the information specifically in OSVET Plan itself, please do contact Animal Health Australia, because these documents are under copyright, and we don't appreciate people just using the information without contacting us. But the format and the template, happy for you to use those if it's useful. And also understand the legal requirements for movement controls, because in Australia, each state and territory has its own legal requirements and how they go about enforcing movement controls, movement restrictions. There's certain directions and control orders that certain states and territories need to put in place. It's just useful to have a look at those legal requirements and work out how these things would work. Also understand feral pigs, because as I mentioned, within Australia, we would be very, very concerned about feral pigs and be, doing a lot of work to do surveillance within feral pigs and, control of the disease as quickly as possible within those feral pigs to make sure that it doesn't, spread within the feral pig population. So it's really important to understand what the feral pig situation is within the country and how you would deal with it. And then public awareness, that's the other thing, is making sure that, the public is really aware of how a response would work, what the mechanisms would be, what's the principle, what would be the ultimate goal that you'd like to achieve. So these are things that I would recommend that you have a look at if you're actually setting up your own strategy, your own response policy for an outbreak of African swine fever. So thank you very much. And also, I just encourage you to have a look at our website and also have a look at our EAD, or Emergency Animal Disease Online Foundation course. That you might find that useful, because it actually talks about the structures and systems in Australia. It goes into maybe a little bit more detail than I've gone into today, and also provide you with some useful information on how we do things in Australia and how you might be able to do things in your countries as well. So thank you very much for that.
Bueno, con eso teníamos la excelente.
Well, with that, we had the excellent presentation by Dr. Dag and all of his team, that with a great effort, they were able to send to us this video with all this information and provide us this link in which we might be able to have a training. And well, you can see As you can see, they are offering to take the Ausvet plan as a reference, and we can count with them and all those resources that they are providing us, that are being provided to us by all the countries that have had so much experience in regard to the preparation to be able to respond to the AFS. So these are the excellent presentations that we had for today. We would like to thank Dr. Marius Vasilius, Dr. Anna, Dr. Dag also for all the experience that they have shared with us. And we are going to go on now to the moment of the questions, because we have many, many questions, both in the chat as well as in the question and answers. And we have them already selected with our team from the OMS and the ICA who have been selecting the questions. So we're going to begin with this section. We are going to begin with Dr. Marius Masilius. The first block of questions is directed to you, Doctor. And they are asking us, Dr. Eric Etter, on behalf of the CARIVET, which is part of this group, the Caribbean Veterinarian Association, if there is not a link, a direct link between the head of the official veterinarian services and the National Center Crisis Center. Is there a direct link between them?
Okay, thank you for the question. Actually,
muchas gracias por la pregunta. De hecho,
our structure differs a bit.
Nuestra estructura se difiere un poco. Nosotros tenemos el Centro Nacional de Control de Enfermedades, que es encabezado por el... perdón, sí, sorry, I had not switched to Spanish.
Okay, so should I continue? Okay, so I will explain a bit. So actually, our Chief Veterinary Officer is the part of the National Disease Crisis Center. So in between, we have the National Crisis Center, which is headed by the Minister of Internal Affairs, and it covers all the governmental institutions and not only the competent veterinary authority. In case of an emergency which is related to the animal disease, for example, as it was at the beginning with African swine fever, our Chief Veterinary Officer was appointed as the head of the National Crisis Center. But there are two separate, I would say, structures: National Crisis Center and National Animal Disease Center. So they are interlinked, but so they have no direct link if it is not linked with the animal disease emergency. Hope now it's more clear. Thank you for the question.
Muchas gracias, Dr. Marius.
Thank you, Dr. Marius. Does this answer your question, Dr. Ether? Okay, Eric, if you want to expand a little bit more of the question, you can do so through the chat. We are going to go on with the next question. Also for you, Dr. Marius. This person did not write down his name, but it says, how does the cooperation with the neighboring countries work? Is it difficult, or are you able to do it easily?
Thank you. Very good question. And as usual, with the communication and cooperation with the neighboring countries, so there are many challenges, but actually we do not see many problems, because there are regular exchange of the information via all available sources. So as the part of the European Union, we exchange and we inform the neighboring EU countries using the ADIS system, where the immediate notifications are provided, as well the countries which belong to the non-EU. So we provide all the information via VAHIS or via official letters. We had previously many meetings together, but due to the current political situation, as in our neighborhood, so there are the Russian Federation and Belarus. So of course, those meetings now are not provided. But still, all the information as regards the epidemiological situation is visible to them as well through the WAHID system.
And for this question in particular, we would like to have the point of view and experience of Dr. Ana Ramirez Vela. As you work with all of the countries in the EU, it would be good to have your input in this regard. As Marius said, within the European Union, we do not have many problems on a regular basis because, well, first, we have a lot of regular meetings where the veterinarian heads expose or present the situation or the status of the disease in their respective countries. And also another situation in the EU is that whenever the disease moves around, there is a modification of the legislation, an amendment to the legislation that takes care of all the areas that may be affected. So if there is an outbreak at the frontier with Lithuania and this affects another European country, that area would be within the restrictions straight away, automatically. It would be listed as part of the restrictions. The problem is bigger when we are dealing with non-EU countries. As Marius said, it depends a lot on the political situation. In each case, ASF is a disease that arrived in our territories because of foreign boundaries, and sometimes cooperation is a difficult thing to materialize. It depends a lot on the bilateral relation of the countries at stake, and it also has to do with the political relationships that the EU may have with neighboring countries. In some cases, for some diseases, the cooperation is good. We even pay for surveillance plans. But considering the current political situation and, what is going on with Russia and Belarus specifically, we are in dire straits. With the Ukraine, the situation is good communication-wise, but the thing is that implementation-wise, they are being faced with a lot of limitations currently for reasons that we all know. And it is very difficult for them to implement the same kind or the same number of restrictions that we implement. Dr. Anna, and maybe to complete this question, as Dr. Marius said, communication with commercial partners, how is that moving? How is that happening? Well, in general, it's okay. On a regular basis, the EU is quite open. Documents are public, audit reports, for example, that are performed in the affected countries, as well as the presentations made by the countries at the EU meetings are made public, so everyone can access them. They are open to all of the countries that trade with us. We also receive audits from commercial partners, such as Japan, Korea, the Republic of Korea. We usually facilitate audits by these guys so that they get to know the status of the disease in the various countries, and usually notifications are sent out immediately to the worldwide organization. So I believe that along those lines, the EU is quite open when it comes to communicating the actual situation. Dr. Marius, would you like to add to that answer, or should we move on with the next question?
Dr. Anna has has provided the complete picture, and just to add to them, actually, in case of an outbreak of such a contagious animal diseases, so there are immediate notification as well, the official letters with the support and with the help of the European Commission. All this information is distributed to all the trade partners, so they are aware what's going on in each and every country which belongs to the EU. So that's, I think now we have the complete picture how the information is shared and moved on. Thank you.
Gracias, Dr. Ana y Dr. Marius.
Thank you, Dr. Anna. Thank you, Dr. Marius. The next question is addressed to Dr. Marius. It is posed by Milton. First of all, he thanks the speakers for their presentations, and his question is, in the case of eliminating or killing the pigs, Is there a replenishment of the same number of culled animals to the farmer? Or how do you go about dealing with this problem vis-a-vis the farmer? And what disinfectant has been the one that has worked the best for you? Is it clear? Please let us know.
Okay, thank you. I will try to reply. Actually, when the outbreak is eradicated, it's based on the decision of the competent authority and the proper disease control measures implemented. It's possible to the farmer to perform the restock of the eradicated farm. Of course, the restocking procedures again are very clear, and there are a part of the legislation and as well as the part of the contingency plans. So the restocking can be done when we have some of the sentinel animals placed at the previously infected farm. And then using the sentinel animals, we can prove that the disease is eradicated or other measures successfully implemented. In our case, and in case of all the European Union, all the members are belonging to the European Union, so there is the compensation system, which compensate the farmers in case of the animal disease emergency for the killed animals. Actually, there is no replacement, but the farmer is granted by the amount of the money established by the national government. And then each member state can refer to the European Commission by asking for the co-funding of some of the eradication measures. So actually, we receive a huge support from the European Commission, and this helps us to maintain the proper level of the notification and further to help to the farmers to minimize their losses in case of the replenishment of their killed pigs. As regards the disinfectant, actually there are a various range of the different disinfectant and there are many commercial names available. Each country has their own authorization system, and I will not list their commercial names because they would not tell you anything. So maybe Virkon is widely known, but really there are many of them. So the most important that the disinfectant which is used with the aim to eliminate the African swine fever virus would be firstly authorized, then allowed to be used in the country, and it should work against the disease agent. So that's the three important factors: authorization, allowance to be used, and the working on the disease agent. So that's the main rule which is applicable to many disinfectants. Thank you.
Muchas gracias, Dr. Marius.
Thank you, Dr. Marius. So moving on with the first block of questions that all of them address to you. As a matter of fact, Dr. McAllister asks us. He's from the Andean community. He's also a member of this group. McAllister, he wants to congratulate you on your presentation, and he has 4 questions. First one is, what is the role of the European Commission in the command chain in Lithuania? So I believe that this question can also be answered by Dr. Anna, or by both of you, actually. And the other question is, how has epidemiologic surveillance worked, passive surveillance, during the outbreaks of ASF in domestic pigs? Passive surveillance, right? You can go ahead and answer this part, and then I can move on to the other 2 questions, okay?
Okay, thank you for the questions. Of course, I have pointed the European Commission on the top of the chain of the command, because actually this is the very important organization to which we provide the immediate notifications. So all the measures on the animal disease eradication are based on the European Union legislation. Of course, the coordination in the establishment of the restricted area, infected areas to which we relate. So everything is done with the help of the European Commission. As well, the proper sharing of the information between the member states, again, it goes not separately from the one member state, but it goes through the European Commission. So the dissemination of the information, so that's those proper channel which provides the information not only to the EU countries, but as well outside the EU. Again, so that's the European Commission. And I think Dr. Anna can add as well some of the procedures, how the countries communicate. But we actually consider the European Commission as a member of our chain of the command, because the regular exchange of the information and as well the coordination of the measures we consider as the very important factor for which the European Commission plays, again, very important role. So then moving to the second question that was as regards the passive surveillance. Actually, we are following the strategy of the European Commission on strategy of African swine fever control and eradication. Based on that strategy, we rely very strictly on the enhanced passive surveillance, which means that we do not sample clinically healthy animals and we do not test them for the presence of African swine fever virus. So we are focusing to the dead animals. And this is, so that's our system mainly is based on the commercial and non-commercial pig farms. We are collecting the samples from the last two dead animals, the last two dead pigs on a weekly basis, and they are tested for the presence of African swine fever. We have already understood that African swine fever is not a highly contagious disease which spreads very, very quickly. And African swine fever can be undetected for even several weeks if you do not test the dead animals, because the first symptoms can be just the sudden death of a few animals. So that wise, all the system is based on the enhanced passive surveillance, on the collection of the dead pigs from all type of the holdings, sending them sampling, sending them to the National Reference Laboratory, and testing for the presence of the virus using polymerase chain reaction method, PCR. So we have already proven that this system is the best for the early detection, and we're using this in the entire country. I hope I covered both questions. Thank you.
Gracias. Sí, perfecto. Adelante, doctora Ana.
Thank you. Yes, please go ahead, Dr. Anna. Just to make things clear, the EU works as a federation of states. This means that the European Commission works as an administrator, so to speak, of the whole ensemble. So in principle, the role that we play is we create shared legislation across all of the countries. We coordinate, especially when the various countries are involved. We do not have a role as such within the command chain of each state. It means that each state is independent. They have their own command chain, and we are above the member states. So the member states get in touch with us when necessary. They sometimes get in touch with us to ask for help, or they may ask for recommendations, orientation as to what is going on in other countries within the EU, etc. But within the contingency plans, these plans are individual for each member state, and each country decides on a national basis who does what, who informs who, that is to say the chain of command, which changes depending on whether we are dealing with everyday stuff or emergency stuff. As Mario said, the European Commission is at the top of the pyramid, and we receive all of the information given by the national systems, and we coordinate between the various member states. With regard to active surveillance, there was a question that was posted on the chat prior. For example, as Marius said, there is a strategy, EU pan-EU strategy, which is recommended for the states. It's not binding. So it is not legally binding for the member states, but these are recommendations that we try to get member states to follow. And there are other factors, for example, like money that is granted to the countries so as to aid in conversations. It is true that some countries are using active surveillance. I wrote this before in the chat. I do not know about its effectiveness, but my feeling is that it's not very effective. For example, sometimes it's used for moving animals around in some areas. So in a systematic way, they test all healthy animals before moving them around. They've never found anything, not that I know of, using this method. So as Marius said, the most effective system, the recommended one, is to perform passive surveillance for some kinds of animals. Thank you, Ana, for complementing this question. Thank you for mentioning that it's important to have the perspective on how work is being done with the member states of the EU and the recommendations that you have for these questions. The next question is for Dr. Marius, and it's posed by Juan Luis Ucelli from the prevention group of ASF for Latin America. So he has several questions again. Yes, how do you manage the concept of general people when it comes to slaughtering? Let's just say, he means public, the general public, when it comes to slaughtering the animals or to culling them. It's not clear in Spanish. So this question is addressed to Dr. Marius. And we have another question. Do you impermeabilize? Do you make the pit watertight and airtight? Watertight when it comes to describing the pit that receives the carcasses. And how long does it take for you to restock a farm that was affected? Do you start out with sentinel animals, for example? So those would be the questions.
Thank you for the questions. I will try to repeat the first one if I understood correctly. So that was as regards how we manage with the public in general when it comes to the number also of the animals to be killed in the affected holdings. Am I right? Okay.
Así es.
So, okay. So actually, we have the African swine fever since its beginning when it enters the territory of the EU since 2014, and during this almost 9 years, we had several outbreaks in the large commercial pig holdings, where approximately 20 to 25,000 pigs were affected. And of course, the general principle on the disease management, that's the proper eradication by killing all the susceptible animals being on the farms. Thanks to the various awareness campaigns, we have constantly explained to the public, to the different stakeholders, what are the disease control measures. And that's the most important, of course, to work on the prevention and biosecurity, not allowing the disease to enter. But when it enters to the farm, irrespective from the farm size, so the only measure to properly maintain the disease and to eradicate it, it is to kill all the animals which are present on the farm. While doing that, we are trying always to have the location which is not very accessible for the public in general. As we are using the gassing system, we're using the CO2, mostly in the pedicles. Actually, it's not very visible for the public because the animals are chased into the pedicle, so the gas is connected, it blows in, the pigs are died inside the container, and then those containers are delivered, the dead pigs, to the disposal site, even to the rendering plants directly, or to the site where they would be buried. So the public is really aware about the measures, what the competent authority should do in case of the outbreak of African swine fever. As regards the pits, again, if I understood correctly, so the question was about the gases which appear from the cadavers and the restocking. So what we did and what we learned from the several outbreaks with the numbers of the pigs affected, that before to place the carcasses inside the pit, we actually cut the bellies and penetrate the stomaches, such to avoid the gassing, the explosion, and we're using the different layers for the feed or bedding material as an absorbent layers, which again prevent for the leakage of the fluid and the gassing. So that wise we do not use any tubes which would use as for the gases would be able to get out from the pits. And as regards the restocking time, it is very clearly set in the legislation that it should elapse at least the period for the disease agent. Actually, okay, I will rephrase. First of all the disease eradication measures should be implemented, including the final cleaning and disinfection of the infected premise. If everything has been done in the proper order, and if it has been checked and verified by the competent authority that the final cleaning and disinfection is performed in the proper way, so then we can wait at least for the period of the incubation of the disease, which means at least 15 days before the first sentinel animals would be moved into the previously affected farm. And then we will work with the sentinel animals to verify if really our eradication measures were successful and if really all the procedures has been done in the proper way. So yes, sentinel animals firstly are placed, and we're placing those animals inside the territory of the infected farm, that in such a way that for the pigs would be accessible each and every corner because they are moved freely. And then after again the incubational period of African swine fever, which is considered 15 days, we should take the samples to verify if the pigs got infected or not. So that's the procedures. Again, that's the legal requirement from the European Union regulation, and we strictly follow that. And it's very difficult to say properly in time, because in 1 hour farm with almost 26,000 of pigs, which was affected, the time frame between the final, so from the preliminary cleaning and disinfection till the final cleaning and disinfection took almost 1 year, because they were forced to remove everything, to dispose properly the liquid manure. So that's really long process, and it needs a lot of time to do everything in the proper way.
Adelante, doctora Ana, si nos quiere complementar.
Please, Dr. Anna, go ahead. Yes, I just wanted to say that with regards to public opinion, there has been more pressure in connection with the killing of wild boar rather than the killing of domestic pigs in general. As Marius was saying, it's a process that is not visible for the public, not really. It is done inside the farm. The general public does not have access to that process. Still, the countries that have attempted to do away with wild boar populations, usually that happens in forests, in natural parks, hunting. They are hunted with cages and then they need to be slaughtered, and usually it's females and their babies, and people are more susceptible because of that, or there might be young animals involved. And some countries have decided to use the army, like a general deployment of the army, so as to kill these animals. Of course, this has had bigger public repercussions, and this has implied more problems for the authorities wishing to carry these processes out, more than with domestic pigs. Thank you so much. As a matter of fact, that is what I wanted to share. I believe that many of the questions that have been posted here, it's really interesting to have Dr. Anna's viewpoint. So this first block has been addressed to Dr. Marius, but Doctor, please feel free to chip in for these questions. The next question says, the surveillance of wild boar is it done by the same agency that performs surveillance on domestic animals? And how is culling performed for this species? So let's have Dr. Marius answer, and then we will move on with Dr. Anna.
Okay, thank you. Very good question. In our case, our State Food and Veterinary Service is responsible for the organization of the surveillance campaign, as well in the wild pigs. In our case, that's the wild boar. So in the close communication and cooperation with the hunters and their associations, we have established the network of the samples collection over entire the country. And as the wild boars are hunted, the samples are collected. We have the specific biosecurity measures for the hunters and for the hunting grounds, for the especially infected hunting grounds. But as the entire my country is considered as infected, so everywhere the biosecurity measures are in place. And those biosecurity measures covers the authorized dressing area or dressing houses where the hunted wild boars are dressed and their carcasses are stored till the laboratory results would be available, because we have allowed to consume the negatively tested wild boars for the hunters for their personal usage, without any possibility to place the wild boar meat on the market, but exclusively for personal consumption. So the network of the sample collection is established, and the National Reference Laboratory performed the testing of those samples. In case of positive result, again, official veterinarian are present and to help to destroy the carcass. We use the burial system as well for the wild boars, because our rendering plant capacity is not very high. In case of negative result, the hunters are allowed to consume the meat locally. So actually, same veterinary service is responsible for both, for the domestic and for the wild pig surveillance system. And the second question, or that was the second part of the question, I think that was, can you please remind it me?
La otra pregunta decía así.
The other question said, how do you carry out the sacrificing of the animals? Sorry, I have many questions on the screen. Yes. How is sacrificing, the culling of the species of this particular species carried out for the wild hogs, wild boars? How are they sacrificed?
Okay, so again, there are different systems in different countries. I can tell only how we dispose the wild boars. I started to explain about the biosecurity requirements at the hunting ground level. So we have the authorized pits inside each and every hunting ground. So they are fenced and they are used exclusively for the storage of the offals, which are remains during the dressing process. And in case of positive results, those pits are as well used for the destruction of the wild boar carcasses. In case of findings of the dead wild boars, we have the system for burial them on spot of their finding. Of course, before to do that, official samples are collected and sent to the confirmation of African swine fever, because the wild boars can die not only due to African swine fever, but as well due to other diseases. But as we consider that the presence of African swine fever in the wild boar population posed a high risk, we're testing each and every found dead wild boar for African swine fever virus, and they are safely disposed by burial on spot.
Muchas gracias, Dr. Marius. Adelante.
Thank you, Dr. Marius. Dr. Ana? Well, to complement, each one of the countries has an organization for services that is different. For it might be the same service, or it might be sometimes another ministry that is in charge of managing the hunting. But in general, we can distinguish two types of surveillance. One is the surveillance, passive surveillance, which is normally carried out, the service that is in charge of that. It is charged upon hunters and general public through information campaigns, through rewards to try to detect the greatest amount of dead animals. And the other one is through the act of surveillance. And as Marius was mentioning, all the animals that are hunted are normally tested. Depending on the service that is normally at the end, there is always going to be a veterinarian who is responsible for the samples to be taken and sent to the lab, and to put the carcass on hold until the results are. If the results are positive, the carcass is destroyed, following the normal conditions for the disposal of the carcass. And if it's negative, the different countries have, depending on the situation of the illness, they have different dispositions. But the normal is for it to go to consumption, private consumption. And that the carcass, and as Marius has been commenting, there are some measures that are mandatory that all the countries have imposed on the hunting quotas, both for the disposition of the product as well as how the carcasses have to be managed, how they have to be immobilized until the results are back, and so forth. What kind of situation they have to have. That is very common. In regard to the sacrifice of the wild horse, the recommendation generally is not to do hunting in the places where they are infected, not to favor the hunt, because that favors the dispersion of the animals. There are countries that have tried, especially in the beginning, to set zones and to eliminate all the population of wild horse with different results. As we have explained during the presentation, for example, Slovakia, they have made the attempt to put fences around the different hogs or whores, as well as to favor the hunting. And in general, there are other measures that are incentivize not the non-dispersion, like, for example, the capture of the animals with different types of devices, cages, and so forth, while they are sacrificed. I don't know. Each one of the countries will sacrifice them depending on their own conditions. I know the case of some of the provinces of Spain, in which they are sacrificed with a shotgun, like if they had been shot, they had been hunted. But I don't know what is the common system, because they cannot be sacrificed in another manner. As I say, each one of the countries manages it the way they can. And at the end, these are agreements between different services. These are agreements that they reach so that they might reach the final persons, which are mainly the hunters or the general public. So that is them that might notify. In the case of the hunters, they have to notify every time they shoot down an animal. There is a protocol that they have to follow.
Muchísimas gracias a ambos. Hay muchísimas preguntas. Creo que vamos.
Thanks to both of you. There are many questions. There are many questions. I think that we are going to make a couple of questions more, or a few more questions, and The rest of them, we are going to reach them to you, send them to you via the email, respecting the hour that each one of you has, because right now it is late for you already at night over there. So the next question, also in the same line of thinking, it is addressed to Dr. Ana Ramirez. But please, Dr. Marius, if you can also add to that question, or if you want to compliment, please do so. They are asking us, Fidel Loyola is asking, in the face of the risk of this illness, what procedures must we implement? New procedures should we implement, or to increase beyond the standards of biosecurity that are deployed normally in the farms? Well, I believe that one of the most important things is that when the illness has not yet been detected, the creativeness of awareness, the awareness for the producers, first of all, so that there is a surveillance. It can be a passive surveillance, and looking at the variables of production, not only to have animals die or not only to have a typical systems of the swine fever, but that there might be a very acute cut in the production or a movement in the parameters that the producers are always controlling. What we have seen at the biggest farms and the macro exploitations is that they are normally working very well, the systems for biosecurity at a structural level. In other words, the fences, the separations between the different populations, the sanitary filters and so forth. But nevertheless, at the operational level, they have a lot to be done. Many times there is no registration of who comes in and who goes out of the different expectations, which is difficult, makes it difficult to know. If, for example, there are no controls of immobilization, movement of the animals, of the feeding of the animals, and at what time they arrived, what kind of vehicles, and so forth. Because many times it seems that these are the instruments that are the transmission element instruments between the different populations. This and even in the macro farms, there is a lot to be done because they have centered a lot in the structural fencing, let's say. They have some very good infrastructure, but at the operational level, they still have a lot of work to be done. Dr. Marius, I don't know if you would like to add something to that. Also, this answer in regard to what do you recommend, what procedures do you recommend as a priority, apart from the biosecurity that takes place normally in farms?
Actually, so that's very important question. And living with African swine fever virus, we can confirm that actually by the proper implementation of the biosecurity measures on the different size of the farm or the different types of the farm, it's possible to maintain this farm free despite the area is infected and the virus circulate in the environment, in the wild boars. Because it's really important that all types of the farm will have sufficient knowledge about the preventive measures, especially what does it mean biosecurity? Because it's not enough just to say that we have the biosecurity measures, but those measures should be maintained every time and actually all the time, not only to show that we have some physical barriers, sanitary corridors. We can change the clothes or boots, but they should be maintained by the personnel each and every day. And to do that, the personnel and the different type of the farmers, they should be trained. For them should be explained that they are able to prevent the entrance of the virus into their farm if they would do the following recommended measures. So that's very important. Exchange of the right information, clarification about the preventive and biosecurity measures, and regular awareness campaigns.
Muchas gracias a ambos. Y bueno, vamos con la última pregunta.
Thanks to both of you, and we're going on with the last question, in spite of the fact that we still have many questions on the board. But we're going to make the last question on behalf of Dr. Rocio Camposano. She's asking, could you provide more details regarding the detail of the sponges with the smell of predators, so to avoid the wild horse to go out of the contention zones? And I repeated, could you provide more details regarding the use of the sponges with a predator smell as to avoid the wild horses to go out of the contention zones? And the other question is, can you give us some ideas to integrate the high-level authorities in the drills? Please, Dr. Ana, and you begin. Well, the truth is that I cannot give a detail in regard to the use of the sponges. That is something at a practical level. I can pass the question on, for example, to the official services that have used them, and maybe answer in writing. I don't know if Marius, that has a larger experience and has seen many countries, maybe he has a little more information regarding those sponges. The truth is that that seemed like a curious example to put in my presentation, but I don't know much about that. To show that there are different ways that different countries use to try to contain the wild horse populations. The majority of them have not worked adequately in a general manner. The use of fences, the use of contentions. The most clear example between Poland and Germany, where we tried not to have the illness go through with the use of fences, has not been very effective. In regard to how to integrate the hierarchy of into the decision-making will, I suppose that is a little more practical than, as I say, investing in prevention is something that is very political. There is always some needs of services that are very immediate and that people tend to satisfy first. I believe that we can put the example of Europe that followed us a little behind this because we had not invested what we had to. And well, in the beginning was very complicated, but now, for example, the people have tested the plans much better. They have more experience. They are accumulating and they are putting into their plans the experiences coming from other countries. Well, now the responses in the last few countries that we have been much faster. There is a lot of limitation to the illness and the economic losses have been less. It means that from the point of view of the Commission, we are completely convinced that it is profitable both economically as well as from the political point of view, but it is difficult, and we acknowledge it, it's very difficult to sell from the political point of view these investments in prevention. That you are investing the time of your service in putting together an exercise or a drill when everything is very theoretical. If the illness comes, if it affects us, if the plan doesn't work the way it is, etc., etc. But I suppose that each one of the services, depending also on the relationships between the bases and the hierarchies, the vision of the hierarchy, the vision of the hierarchy with the political powers, that is something that is more at a practical level. I cannot give at a theoretical level any other explanation for that. Thank you, Dr. Ana. And Dr. Marius, please, if you care to add something to that.
Maybe I will add something to these chemical substances, so-called repellents or chemical odors, which has been used in some of the countries as a preventive or movement mitigating measures. So actually, so there are many commercial names available, and so that's the mainly chemical substance which contains some of the odor of the different predators. It can be a combination of the lynx, bear, wolf, and human, and they are aiming to prevent or slow down the movement of the different wild boar herds. Actually, it has been proven as effective in the very limited areas when you have the disease introduction and when you aiming to prevent the movement of the wild hogs or wild boars into longer distances, because you should regularly maintain such a fence. So those odors, those sponges which are filled with this chemical substance should be maintained regularly. That means you need to calculate, and you need to have enough human resources, enough financial resources to maintain such a chemical fence. And of course, the effect, it's very, very, actually, it's very short in time, but it helps if you would like to maintain the infected population in the limited area for the very short period of time. But for the commercial names, I'm sure that even in America's continent, you might find many of them, and the farmers time to time use them to prevent the wild hogs, wild boars to entering their fields and to perform the damage to their crops. But actually, do not expect the long time effect, because it lasts for the limited period of time. It is effective if you have the very small infected area, and it can contain the population inside the fenced area for the very limited period of time, because the herds are the wild boars, so they're trying to escape. They're moving to other areas, and they easily broke such a chemical fence.
Muchísimas gracias a ambos.
Well, thanks very much to both of you for your responses. Honestly, this webinar has awakened many interests. As I tell you, there are still many questions on the board. And well, this really makes us happy, because in having questions and having comments, it means that the countries and the participants in this webinar are committed to and interested in getting ready in face of the African swine fever. So I would like to thank you for all your effort. Dr. Marius, this is the second time you have accompanied us here. I don't think it's going to be the last one. And also for Dr. Anna, it has been a pleasure. So thanks to both of you, to Dr. Dag also, that and all his team, that they put together a big effort to send us the video also. And to thank once again to our working group, integrated by all the organizations mentioned at the beginning, all the international and regional organizations that work under the framework of the ESR, and that weekly we come together to plan all these webinars and that are aimed in a logical order to train and to prepare all the countries in the response of the ASF, sorry. So to invite you, so that next month we have once again another webinar, and we will be contacting you and letting you know about the date or what date it's going to be. This webinar is going to be regarding the risk communication. So we invite you from now, all the way from now, for the webinar that is going to be held in the month of October, and try to have all this information reach all the countries, not only the official services, as I mentioned before, but also this is a job that is an integrated job with all of the private sector and all the different agencies that have to do with this problem. So thanks to all of you. Thanks to all the colleagues from the OMSA, from ICA that were there managing all the questions, all the ICA team that is also working behind scenes with all these technical aspects of Zoom and social networks and so forth. So to all of you, thank you. And doctors, once again, thank you for bringing us all your experience, for being here at this time with us on this side of the earth. So thank you very much. Warm hug to all of you. We are working on a platform so all this material is integrated in one single place. So very shortly, we will be sending you that link so that you might have access to all the materials related to African swine fever. So with that, please receive a warm hug on our behalf, and we will meet in the next webinar, and have a good day, or good night in your case. Thank you. Thanks to all of you, Dr. Marius and Anna. Thank you.
Thank you so much for your
Gracias. Hasta luego.
webinar. Bye.
Thank you very much. Bye-bye.